Hello everyone, we're Team 37 with our product Soteria for humanity. I'm Ella Brinkman with my teammates Boyd Colburn, Matthew Nessler, and Jocelyn Ortiz.
COVID-19 is a virus that spreads from person to person that can negatively affect your upper and lower respiratory tract. Currently, in the United States, there have been 5,064,171 total positive cases of COVID-19 reported, as well as 162,407 total deaths. The CDC recommends wearing a mask and social distancing to help prevent the spread of the virus. However, there are a variety of complaints regarding masks that tends to discourage some to use it. Soteria, our mask product, will hopefully alleviate some of these concerns.
The major complaints that our group sought to fix were difficulty in communicating with the mask on, pain behind the ears, and difficulty breathing. The three main discomforts we aimed to fix were found by surveying 54 participants and by looking at our own mask experiences. When masks cause discomfort, it is less likely that people will wear them. Therefore, it is very important to have a mask that many people will want to wear.
The Soteria mask is a clear mask in order to provide the ability to better communicate while still maintaining the required standard of protection. In addition to this, the Soteria mask has detachable cloth sides to improve the ease of cleaning and is created to be produced in a DIY manner, thus providing the chance to be custom fitted to the user, which, along with the elastic cord locks, provide a much more comfortable fitting mask than the standard one-size-fits-all cloth masks. Young children often learn how to communicate and understand other people's emotions through the use of facial cues and therefore find it especially trying to communicate in these times. The Soteria mask is especially valuable in addressing this as well as the problems faced by those that have an impaired hearing ability, such as the elderly and deaf populations, and those that work with them. Even if you are not affiliated with one of these groups, you will find that the Soteria mask will provide a greater ease of communication while also improving the comfortability of wearing a mask and maintaining the standards of protection.
Our team focused on creating a low-cost mask that would be accessible to a broader population. Not only did we use most materials you can already find in your home, but it only takes around 20 to 25 minutes to assemble it. This gives you the opportunity to create it at your own time and pace, as well as individualize it to your liking and fit. Here's a list of items that you will need to create your own Soteria mask.
Now let's watch a quick time lapse of one of these masks being made. It'll go quick, but the step-by-step instructions are up next for a slower walkthrough. First, you can see the plastic bottle is cleaned, cut, and molded to the desired shape. Then the cloth mask is cut and sewn, followed by Velcro being added so that all these pieces can be attached together. Foam, then elastic cord locks are added to make the mask more comfortable for the user. Here are the specific instructions for building the mask. Feel free to pause the video here if you'd like to build your own. The biggest thing to take note of in these instructions is that if the plastic bottle you use is already fit to your face, don't heat it. Taking out that step reduces the chance of warping the plastic, which allows the mask to be more clear and improving the communication. Here are a few tricks and tips I noticed while making a few of these masks. I experimented with several kinds of bottles to find which kind was the best for visibility and forming, as well as different ways to heat and bend the plastic. It's important to note that these three listed heating methods are not the only ways to do it, and you're welcome to take some creative liberties with the design process.
Thank you to Slides Go, Flaticon, and FreePick for providing the visual resources for this presentation. Thanks so much for watching. Please click the like button to support our team.